Yeah, thank you so much. This is Farida Begum from Bangladesh, and I'm working at the UNFPA as a national midwifery consultant. I worked in the government long time, more than 20 years, and worked at WHO 10 years with the position of consultant and other program officer. And also for UNFPA, I'm working 13 years now, but I am retired from UN and now working as a consultant of midwifery. I did my master's and PhD on health science. This is my background, and my passion is to support the midwifery development and strengthening of midwifery in Bangladesh. Yeah. So other resource person also introduce, or I can start?
No, Rowsan.
Okay,
Rowsan?
Yes, Rowsan, please go ahead.
Yes, Assalamu alaikum, good morning, good evening, and this is Rowsan. I'm working at UNFPA Bangladesh as a national midwifery officer. I'm the registered nurse midwife here, and I have been working as a community health nurse, school health nurse, and palliative care nurse in my earlier career. Now I'm working as a national midwifery officer almost 4 years. So thank you and welcome all the midwives here to the International Day of Midwife. Thank you.
Thank you so much. And now the floor for you. You can start your presentation. Thank you so much.
I'll just quickly.
Joy also here.
I'll just quickly introduce myself. Good afternoon, good evening, good morning, everyone. My name is Joy Kemp. I'm a British midwife, but I'm currently working in Bangladesh with UNFPA as an international midwifery specialist. And our colleague, Dr. Hassan, is not able to join us this evening, but he did a lot of the work on this. So we just wanted to acknowledge his contribution. Thank you. And over to you, Farida.
Thank you, Joy. I'm so sorry. Accept my apologize because I missed your name. So sorry. And
no problem.
No problem. Okay, so the floor with you. You can continue.
Okay, thank you so much. Again, good evening, good night, and good afternoon, and happy International Day of Midwife. We are so happy today because we had a good, big event, and it was so successful. So we are happy. Anyway, so today's topic is, already you mentioned that this is an exciting topic, that connecting midwives with their rights and protecting midwives and students against workplace abuse in Bangladesh. This is really excellent. Next one, please. Sorry, content. Yeah. So first part, I will address the background of this framework and also the background of the midwifery in Bangladesh. And Rowsan will cover the process of development of the framework. And Joy will cover the challenges and recommendations. Next, please. Next, please. Okay. So as per international and national standard, conventions and charters, we can say the workplace right and nurses and midwives, that is practice in a positive environment, which can provide, personal safety, freedom from abuse, violence, and threats, injury, and hazards, and so on, and treated in a spirit of brotherhood, and not to experience any kinds of discrimination, any kinds of torture, cruelty, or degrading treatment, and presume the innocent until the proven of the guilty. Without proven, it will not be, declared. And we should consider the rest, recreation, leisure, and reasonable wages, adequate standard of living. So access resource structure, I mean, these are the first aid, sick room, restroom, drinking water, dispensary at work, and so on. So this is the structure we should consider. Yeah. And privacy of the family, home and correspondence. Sorry, this. Yeah. And right to join the associations and any form of trade unions, and security in event of unemployment, sickness, or disability. Next one, please. Next one, please.
Okay, okay.
Yeah, next one, please. Yeah. So in this framework, we have identified some important terms out of many terms. These are safeguarding, sexual abuse, sexual exploitation, harassment, and retaliation. I'll not discuss details, but all the terms we use in this framework. Next one, please. No, background. Okay. Yeah. Background, I have to say that, the nurses, 90% nurses are women in Bangladesh, and 100% midwives are women in Bangladesh. And we know globally, women, we are facing, discrimination, many kinds of discrimination. So as a health workers, nurses and midwives in any country, they have rights to safe and decent working environments and freedom from all kinds of discrimination, coercion, and violence. And nurses and midwives face frequent bullying, harassment, and abuse in the workplace. We have identified in study that they are suffering with this. And midwife and nurses are not aware of their workplace rights. Many times they are not aware. Not all, but most of the nurses and midwives, they are not aware of their rights, And recent one study showed that, within the 6 years, only 5 cases are reported, complaint reported at the DGNM because of the fear, nurses and midwife, they fear negative impacts of themselves. And even when after filing the complaints, the harassment can happen again. So this is the condition. And in response of this situation, in 23-24 fiscal year, the UNFPA, with the support of UK government, and that support of UK government, we have supported Directorate General of Nursing and Midwifery, which is the administrative body, I'll discuss later on, to develop this safeguarding framework. Okay, so I briefly discuss about the nursing and midwifery overview. We have the Bangladesh Nursing and Midwifery Council as a regulatory body, and Directorate General of Nursing and Midwifery. This is the government body under the Ministry of Health and Family Welfare. This is the administrative body to run the nursing and midwifery profession in Bangladesh. And we have Directorate General of Health Services, all the health settings under this Directorate General of Health Services, and we have Directorate General of Family Planning. We have also the private sectors as well. And we have Ministry of Local Government, Rural Development and Cooperative. Under these city corporations and municipalities, we can call urban health, and other area we have the military, police, jail, border guard, railway, government employees, and hospitals. Government employees, hospital we have. And many NGO sectors. Thank you. Next one, please. Okay. This is very interesting slide. Already Judith mentioned something. Before presenting, I should acknowledge the Judith contribution from the journey from 10 to 24, 22 actually. And she was involved with the development of first curriculum of the midwifery, professional midwives and the certified midwife as an interim period. So 2010, we have started in this slide, you can see how fast the midwifery, education and services expanded in Bangladesh. So 2010, we have established the Bangladesh Nurse Midwifery Association. We call Midwifery Society for advocacy of the midwife. 2013, we have started the journey of professional midwife, 3 years diploma midwifery program. And 2014, we actually created the 3,000 post for the registered midwife. And 2015, our diploma midwives, they have graduated. And I mentioned that certified midwife as an interim measure for the interim 6 months training for the nurse midwives, which are 1,600 trained, and we place them as midwives. That was an interim measure before deployment of the registered midwife. And 2016, before already when the registered midwife, license, that time we have developed the standard operating procedures. So they are for midwives, how they can practice independently and how they will collaborate with the medical doctors and when they will refer. That is the standard operating procedure. And 2017, we have started mentorship program for the student, where the student will be placed, and also the where the deployed midwife will place, and they will get the mentorship, support. Before starting the deployment, we have started mentorship. So 2018, Bangladesh government deployed 1,149 midwives, the registered midwife, I mean the professional midwives. And 2021, another deployment, 1,408. And 22, this is another achievement that we have started in service BHC program, which is the prerequisite criteria for faculty managers and also mentor, supervisor, whatever. That is the prerequisite for the midwives. That's why we have developed the BHC in midwifery program, and it started 2022. 24, we have, declared that 401 and 518 position will be created. It is on the process. And 2026, hopefully we'll start the master's program in Bangladesh, in-country master's program. But before that, we had blended master's program, 150 faculty got the blended master program from Sweden. So they are working in different midwifery schools. So now I'm going to invite Rowsan to start the next part. Rowsan, please.
Okay, thank you.
Thank you so much. Thank you so much for listening. Me. Yeah.
Okay, thank you so much, ma'am. Now I'm going to tell about the process. Can you move the slides, please? Okay, thank you. So we followed a structured and inclusive process to develop and implement the safeguarding framework called PDCA cycle. So first of all, we identified the problem and developed a concept note to outline the issue and need for actions. And then we set clear objectives and engage a wide range of stakeholders early in the process. And then we reviewed the existing systems, safeguarding mechanisms, in the nursing and midwifery institutions, hospitals where midwives and nurses are working, and the DGNM itself. But we didn't find any written or formal documents on the mechanism except the disciplinary committee or unit for dealing with the misconduct only. So then we conducted the extensive literature review, including the published literature grey literature, government service roles, existing policy guideline, etc. Based on these, we developed the detailed proposal and costed action plan. And then we formed a working committee, including the experts for their expert opinion. And on the draft SOP, we have invite another stakeholder consultations to get their feedbacks. And on the feedback, again, another working committee worked for 5 days and finalized the documents. So after that, it went for the approval from the Ministry of Health and Family Welfare Service Divisions for the approval. And in the implementation part, we have established the safeguarding cell at the DGNM with 24/7 hotline and dedicated email address. And for the dissemination, awareness, and sensitizations, we have conducted day-long orientations in the country, across the country, covering all 8 districts from nursing, midwifery, and students. So more than 500 participated in the orientation program, and 40 faculty and nurse managers received the duty program on the safeguard SOP. Next, please. Okay. So this framework was designed with the 6 core objectives, all centered around the protecting and empowering nurses, midwives, and students in Bangladesh. First objective was to prevent sexual exploitation, abuse, and harassment when it does occurs, to ensure there is an effective survival center response that prioritizes safety, dignity, and support to them. Second one is to create a safe and enabling environment, working environment where nurse and midwives can do their jobs without fear of abuse, discrimination, or harm. Third one is to educate and inform all nurses, midwives, and students about their workplace right so that they can be aware what protection they are entitled to and what behavior is unacceptable. And fourth one, to build the capacity of the health manager so they can both prevent and respond properly if it is happened. And fifth one, to empower the workforce, helping nurses, midwives, and students understand how to recognize, report, and prevent abuse. And final one, to establish the dedicated, well-equipped safeguard cell at the DGNM for the prevention response. It is not only just idea, it's a realistic and functional system established by the DGNM, supported by the UNFPA and UK government. And yes, this is the scope of framework. This framework has broad and inclusive scope to ensure the comprehensive protection for the relevant individuals in the nursing and midwifery professionals. It applies not only the nurse midwives, but also students, faculty member, and other healthcare professionals and staffs who work along with them. And the framework will be implemented across all level, all hospitals, institutions, and the relevance where nurses and midwives are deployed or posted. Next one, please. This is the principles of SOP, Standard Operating Procedure. This SOP includes the zero tolerance. First principle is zero tolerance, means no harm of sexual exploitation, abuse, or harassment will be tolerated. Strictly action will be taken against the perpetrator. And do no harm ensures that our actions never cause additional harm to the survivor. We prioritize their safety and well-being, and survival centered approach and confidentiality also will ensure and will be shared with those they are involved with the process. Privacy and confidentiality will be maintained. Protection and prevention go hand in hand. Support is available for those at risk and aim to stop abuse before happen through the sensitization, awareness, and training program. Proportionately means our response should be appropriate to the situation, causing at least disruption to someone's life. Partnership involves working with the communities and other stakeholders relevant to the nurses and midwives and their working environment. And finally, accountability. Safeguarding is the everyone's responsibility, and we must speak on it. Yes, these are the elements of the safeguarding frameworks. There are some elements. First one to develop the standard operating procedure. So it is developed and approved by the Ministry of Health and Family Welfare, and the local safeguarding committee, national safeguarding committee, and the appeal committee. There are 3-level committee to handle this, and the dedicated 24/7 hotline number and the email address to address this, and data management systems, counseling and psychosocial support for the survivors, and countrywide training program and disseminations. Next one, please. Okay. Protection against retaliation is a core part of our safeguarding policy or framework. Anyone who report misconduct or help in an investigation is protected against them is strictly prohibited. Retaliation itself constitutes misconduct, and any DGNM officials or other members who engage in retaliation may be subject to disciplinary actions, other application sections even, like negative impacts on their annual confidential report, that means a performance report, promotion, annual increment, practice license, higher educations, foreign training, official tour, it will be not given for them. Okay, so next one, please. Next one, please. Okay. This is the safeguarding flow chart. Safeguarding mechanism will be started when the survivor or victim will complain or submit their allegations to the safeguard cell or local committee, national committee, or any committee. So there is options. They can be complain verbally, over phone or in person, even can write email or letter, and the committee will actions it as soon as possible. It is recommended that within 10 working days, investigation should have contact, and immediately investigations report will be submitted to the cell and designated person, and the report will be published to the victims within 30 days. Actually, it will follow the High Court Divisional Directives 2019 here law. So as per the law, by 30 working days, they should publish the reports. If the victim or survivor not satisfied with these decisions or outcomes, they can appeal to the they can submit the appeal to the appeal committee. There is the external members, including the DGNM and Honorable Secretary from the Ministry, and other law person will be included in the appeal committee. That's all from my side. So now I'm going to invite Joy Kemp. Joy, please. Thank you.
I just want to say, to give everyone, we have a 7-minute warning to the end of the session, and we'd like to leave some time for questions. So just bear that in mind as we finish up this presentation. Thank you.
Okay, thank you, Catherine. Please could we move to the next slide? Thank you. Please move to the next slide. Thank you so much. So as you can see, this is a very comprehensive framework working at very high level. And so it took some time, and we did encounter some challenges along the way. Some of you may be aware that within the last year in Bangladesh, there was a big uprising by students, a lot of civil unrest, and ultimately a change of government. And also following that, a change of many of the health service directors and managers and faculty and principals. So this work took place at a time when it was very difficult to make decisions within the government health system. Harassment and abuse is a new topic really in Bangladesh, and it's not recognized much as being a problem even at the highest levels. So there was a lot of work to do to say to people, this is not okay. And there is little evidence of the scale of the problem because it's so underreported. Some really good work had been done previously, but it hadn't been disseminated. Next slide, please. So we learned lessons along the way. We learned that abuse becomes normalized in healthcare systems. And so even at the highest levels, there is often a lack of awareness and knowledge. And so sometimes when you said to someone, this is happening, they said, yeah, well, that happened to me. You know, that's part of life, right? And so you need strong director level leadership to be successful in implementing safeguarding. And we were so fortunate that the new Director General of the Nursing and Midwifery, who is now in post, is really committed to this process. And he has a background in human resources, so is really motivated about this. We need to increase awareness and knowledge about the focus and scope. There was confusion about the word safeguarding. Is it about safeguarding the public, or is it about safeguarding nurses and midwives? So we needed to do a lot of work to make sure people actually understood the scope of this work. And you need, when you're doing a work which is really huge like this, it needs a very wide engagement and consultation with many different stakeholders. And within each organization, there may be many different people that you have to engage with at different layers and at multiple times, particularly as officers may change due to unrest. When the women's organizations and the legal experts got involved to help us, that was a game changer. They brought such a wealth of knowledge and understanding. And so we need those external resource people, but we also need to give them time to understand the context in which we work. So we had some safeguarding experts from other countries that helped us, but they didn't understand our context. So that's really important. Thank you. Next slide. Go back. Is that, oh, then we're done. So that's fantastic. So if you're going to just show the references, please, our facilitator. We put some references. Can you go back to the references slide, please? Thank you. So we've put some references here, including the research that's already been done in Bangladesh, some statements by, for example, the Interagency Standing Committee on Protection from Sexual Exploitation and Abuse, and of course our UN Secretary General's Bulletin on Discrimination and Harassment. So a lot of very good things for you to look at. But I think that's us done now. If we just have the last slide, you'll be able to see our contact details. I think we do have some time for questions. So this is back to you, Hayat, and over to our participants to ask any questions.
Thank you, Rosanna, Farida, and Joy. Thank you for your presentation. I think you touch a very important topic. As we are ensured this is the safety for the patient, we are ensured also safety and convenient environment for the midwife or the healthcare for worker, especially this is the falling sexual harassment or abuse and the violence, because we have this one with all this is what is going around the world. It will be highly stressful. We are living in highly stressful situation. Thank you so much. I think we have one question here from one student. She asked here, please, how have one Susanna from this is the Susanna Kiyu. She said, how have this framework be welcomed by other healthcare providers? So you can answer, please, this question from Susanna. She said, how have this framework be welcomed by other healthcare providers?
Thank you, Susanna, for that question. I can answer that. The framework has just been finalized, but it still hasn't been widely implemented. Some training of trainers has taken place and some orientation in the nursing and midwifery schools, but it's just really still needs time to be fully embedded. So we haven't been able to see what the impact has been on other healthcare providers yet. And one thing I forgot to mention was that also one of the challenges or limitations of this is it was only implemented in the public sector. But actually, as our slide earlier showed, the health system here in Bangladesh is very complex with many private providers, NGO providers, and then military and police. They have their own hospitals. So we hope this will be taken up across the whole health system, but we still have a lot of work to do to make this a safe workplace a reality for all nurses and midwives in Bangladesh.
Yeah. Okay, David, you mentioned also this is one, it will be in the workplace, but this one, it can be applied in the school, for example, for the students themselves, or mainly in the workplace. So did you allow them to apply this framework to the school, or you only applied, or you only make your research in the school health setting?
Farida, do you want to answer that?
Yeah, I can answer this one. Yes, it's for a student as well. And we have student academic board in the institutional level. And from there, they apply to the administrative body higher level. However, students have the welfare body in their own institution through this, and also the student can apply for this. We are preparing for student as well. Yeah.
This is very crucial, really. But can I ask you, which is the most serious cases that you will find it really underreported at the serious case, even in the school, even in the health setting? Did you find something, cases you are really put it as an example for this harassment, or this is the you call for, we need a safeguard for educational institution or workplace that to ensure that all healthcare provider or the student find the convenient safety environment, which is the basic rights for them?
Yes, Joy, can you?
Yes, thank you. I mean, as I said, this is only just in the initial stages of implementation. But the reason it was developed was because anecdotally, many midwives and students were saying they were experiencing harassment and abuse in the workplace, and needing, particularly sexual abuse. Sometimes if midwives, for example, wanted to participate in a training which was off-site, then the health service manager might be asking for some sexual favors in order for them to participate in the training. Sometimes, the abuse is from nurses, maybe to students when they're undertaking their placements. It's not necessarily just sexual abuse, but it can also just be speaking badly to them, or treating them without respect.